For my video on health and illness, I am focusing on concepts including the social construction of health and illness, individual level health behavior model, and social epidemiology analysis. I can see all of these concepts play out in my own life today. The social construction of health and illness is a concept which asks what the expectations are of being healthy or sick, and how these are socially constructed by our society. The individual level health behavior model looks into research on a disease, the importance to medical sociology and society, patterns of disease responses, and social forces shaping the behavior. A social epidemiology analysis looks into the details of a disease, social groups and populations affected, or most likely affected, and social forces that shape disease-related patterns. When looking at the social construction of health and illness, I can see many human actions affected by society's expectations of being healthy or sick. When a person is sick, society expects them to perhaps take time off from work, visit a doctor, and take on that sick role. With the current pandemic, it is expected for a person who tests positive for the virus to do his or her part for society and quarantine themselves, as well as seek care if needed. When people fail to take on society's expectations while sick, these individuals often face judgment. Regarding the individual level health behavior model, sociologists select a specific disease such as cancer or a health condition such as alcoholism along with a particular group and examine the sociological dimensions of health behavior. In my own life, I enjoy researching about health conditions, for example, hypertension. I work with a group of individuals that have this condition, and thus I find myself often examining their patterns to responses regarding updates on their blood pressure. How will one patient respond to finding out his blood pressure has been rising again? Will he change his behaviors? I also wonder in what ways social forces have shaped this behavior or lack thereof. For a social epidemiology analysis, researchers would focus on the social production of disease. In my own life, I too find myself seeking to learn more about the details of whatever ailments I may face, or even the current pandemic. With this, I educate myself on what types of people are more or less impacted by the pandemic, to what degree and why. Also, I contemplate how social forces have shaped disease-related patterns, what have institutions done to limit the spread, or what can they learn to help do so in the future.